Hello WPS team, Superintendent Kelly Bielefeld here. This is the Suicide Awareness and Prevention presentation for the 2024-2025 school year for all Wichita Public School staff. The Jason Flatt Act was created after 16-year-old Jason Flatt died by suicide on July 16, 1997. Since then, his family has been raising awareness of teen suicide. Each school district in the state of Kansas is required to complete at least 1 hour of suicide prevention and awareness training each calendar year. In addition, districts must also develop steps for recognizing suicidal ideation, appropriate methods for interventions, and a crisis recovery plan. We appreciate your time and attention to this very important subject. Suicide can be an intense topic. This presentation contains information about suicide ideation, depression, and personal safety. If at any point you feel uncomfortable, you may excuse yourself and view this presentation at a later time. In this training, we will address warning signs related to suicide prevention, discuss steps to take when someone you know needs help, and provide district and outside resources. Recently, students from high schools across the district created this powerful video.
I have my highs and lows just like anybody else.
Sometimes my lows are really low.
Sometimes I just don't feel like talking to people.
Lately, I've been acting differently.
Acting really sad.
Crying a lot.
Getting really irritated.
Suddenly not doing things that I used to love.
Shutting my friends out.
Drinking, doing drugs, doing things that are just not like me.
It might be nothing to worry about.
Or it might be something more.
I might be depressed.
Not just feeling down, depressed.
Really depressed.
It might be that I'm thinking about killing myself.
It happens more than you think. More than it should.
People often say, I had no idea.
I never thought they'd actually do it.
I wish he had talked to me.
I wish he had told someone.
I wish I had asked.
If you think I'm not acting like I usually do, say something.
Ask me what's wrong.
Ask me directly. Are you thinking about killing yourself?
When people are thinking about killing themselves, they want someone to ask.
They want somebody to care.
You might think asking about it will put the idea in their head, but actually, it will help.
It never hurts to ask.
In fact, the best way to prevent someone from killing themselves is to ask them, are you thinking about killing yourself?
And what if they say yes?
Or maybe.
Or sometimes.
Well, here's what you don't say.
Don't be crazy.
Stop being so dramatic.
Nobody's worth killing yourself over.
You're just trying to get attention.
It's not that big of a deal.
You wouldn't really kill yourself.
If someone says that they've been thinking about killing themselves, what you can say is, I'm sorry you've been feeling that way.
I'm here for you. I'll stay with you.
You're important to me.
I want to keep you safe.
We'll get through this together.
A lot of people think about killing themselves.
Most of them never try, but some do.
So if someone says, I wish I were dead,
I just can't go on any longer.
You'd be better off without me.
I'm going to kill myself.
Take me seriously.
Stay with me.
Listen to me.
Help me find someone to talk to.
But don't just ignore it.
sometimes people think about killing themselves because of something that's happened in their life.
I failed my math test.
My girlfriend broke up with me.
My parents are splitting up.
Sometimes I feel like it'll never get better.
I need someone I can turn to.
Someone I can trust.
A teacher, a coach, a counselor, or a pastor.
I could call 988 and talk to someone at the Suicide and Crisis Hotline.
If you're worried that someone you know might kill themselves, don't leave them alone.
Ask them directly. Are you thinking about killing yourself?
Be sure your home is safe.
If you have pills they could use to hurt themselves, lock them up.
If you have a gun, don't just lock it up. Get it out of the house.
Call 911 if you have to. Everyone has highs and lows, but sometimes it's more than that.
If you think something's wrong, the only way to find out is to ask.
It could make all the difference.
Even if you feel hopeless, there is hope.
No one's life is perfect.
Sometimes, things can be overwhelming.
People can and do recover from even the lowest, most frightening places a mind can go.
Hope and caring are powerful gifts we can give each other.
It can make all the difference in relieving pain and saving lives.
Stay.
Listen, get help.
At this time, we would like for you all to take a moment to visit with someone near you. Please pause the presentation and share something that you will remember from the student video.
We need to be sensitive when talking about suicide. Almost half of us will be exposed to suicide in our lifetime through close or extended connections. It's important to recognize the way we talk about suicide. We need to be aware of what we say and how we say it. One way to be sensitive and respectful is by using person-first language, such as died by or attempted suicide, or tried to kill themselves or end their life. For generations, we have used the word commit when talking about someone who died by suicide. When we use the word commit, it makes people think of a crime. In order to not criminalize suicide, we can practice using more sensitive language. There are 3 common terms often used when referencing suicide. Suicidal ideation is having thoughts about engaging in suicide-related behavior. Suicidal intent suggests that the individual understood the likely outcome of their action, meaning they intended to harm themselves. A suicide plan is when a person has developed an action plan that includes a time frame and a method.
We have seen these statistics before, and unfortunately, the numbers continue to be alarming. That is why this training is so important. Unfortunately, on average, 1 person dies by suicide every 11 minutes in the United States. Over 50% of suicide deaths are by firearm. There were nearly 50,000 adults who died by suicide in 2022 in the U.S. However, that is just the tip of the iceberg. For every suicide death, there were an average of 3 hospitalizations for self-harm, 8 emergency department visits related to suicide, 38 self-reported suicide attempts, and 265 people who seriously considered suicide in the past year. While suicide is the 9th leading cause of death in Kansas, it is the 2nd leading cause of death for ages 10 to 24. According to the Kansas Communities That Care survey from the 2023-24 school year, 1 in 3 students surveyed had feelings of depression within the past year. Alarmingly, 16% of adolescents surveyed seriously thought about killing themselves. 10% made a plan, and 4% actually attempted suicide. Therefore, more than half of the students who thought about suicide actually made a plan, and 1/4 of those who thought about suicide made an attempt. That is why we must continue to respond when we know that someone has serious thoughts about killing themselves. These are the suicide rates in Sedgwick County from 2015 to 2022. You can see that there was an increase in the number of suicides in Sedgwick County from 21 to 22. However, 1 is too many.
It is important to remember that all suicide threats are a call for help and should be taken seriously. We want to emphasize that attention is prevention. Wichita Public Schools has a variety of support staff who are here to help students as well as staff. Every building has a school counselor, school nurse, school psychologist, and school social worker who have been trained to respond to suicide ideation. Our school counselors, social workers, and psychologists provided well over 100,000 mental health services during the 23-24 school year. This includes individual counseling, classroom guidance lessons, small group sessions, and special education counseling services.
KVC Hospitals discussed 5 myths in their September 2021 publication. We're going to take a look at those myths now. Myth number 1. People who talk about suicide won't actually do it.
There is a common misconception that if someone is talking about suicide, they just want attention or won't actually do it. However, that is far from the truth, and in most cases where someone attempts or dies by suicide, there were warning signs in their behaviors and or conversations. Talking about suicide, or more broadly the topic of death, can be very difficult and even feel uncomfortable. But talking about suicide can save someone's life. If someone tells you they are thinking about suicide, take them seriously. Listen to them with empathy and without judgment. Ask them what you can do to help them and encourage them to seek professional counseling or treatment.
Myth number 2. Talking about suicide makes people more likely to attempt suicide.
Talking with an adolescent or teen in an age-appropriate way creates an opportunity for them to share their feelings or concerns. Most youth who are contemplating suicide are relieved when asked direct questions about their suicidal thoughts. It helps them express themselves, seek treatment, and know that someone cares about them.
Myth number 3. Only youth who are depressed attempt suicide.
Many people who attempt suicide or who die by suicide do not have a clinical diagnosis for depression or any other mental health disorder. According to the CDC, of the people who died by suicide in 2019, more than half of them did not have a known mental health condition. People who are diagnosed with depression may experience suicidal thoughts. However, not every person diagnosed with depression has thoughts of suicide.
Myth number 4. Only a certain type of person attempts suicide or dies by suicide.
Suicidal thoughts and attempts can happen to anyone regardless of gender, race, age, upbringing, education level, ethnicity, or other demographic, lifestyle, or socioeconomic factors. As mentioned previously, there are risk factors that may indicate a higher risk of suicide for someone, but all people are susceptible to having thoughts of suicide, including people who don't have any of those risk factors.
Myth number 5. Suicide is not preventable.
People may think that if someone wants to end their life, nothing can be done to prevent it, but that isn't true. Early identification and intervention make it possible to help someone before they attempt suicide. By knowing the risk factors and warning signs and openly talking with people who are struggling, you can be their lifeline. You may be able to help them get connected to supports and resources before they are in crisis or attempt to end their own life.
We're going to take some time to discuss the scenario. Please pause the video and read scenario 1 and discuss the questions on the handout as a group. After discussing possible responses to this scenario, it's likely that you recognize that the first thing the student needs is validations of their feelings and assurance that you are there to listen. Do not leave the student alone. Refer the student to building support staff.
Let's take a moment to discuss how social media impacts mental health. Social media can be a positive outlet and a way for families and friends to stay connected. On the other hand, there are some negative aspects to social media which can lead to a sense of inadequacy, social stigma, feelings of isolation, shame, guilt, or embarrassment. One way to protect your mental health is to practice good social media habits. Here are some ways to utilize social media in a healthy way. Limit when and where you use social media. Schedule breaks from social media. Utilize social media mindfully. Pay attention to how social media makes you feel. If you feel worse after being on social media, take a note of that and start setting limits or finding other ways to connect with others. Prune. Unfollow or hide online friends and contacts that make you feel annoyed, irritated, or upset. Stop social media from replacing real life. When used thoughtfully and deliberately, social media can positively connect people, but it should never replace face-to-face time with others.
Wichita Public Schools Safety Services Department has an online monitoring system that filters staff and students' electronic usage. This allows the district to monitor alerts received from software filters that are designed to recognize keywords contained in internet searches, emails, and activity inside of Microsoft Office. Safety Services identifies those search results that may pose a substantial threat to students, staff, or school safety. Administrators are then alerted and support staff follow up on those concerns. Over the past couple of years, thousands of alerts have been generated from our online monitoring system. During the 23-24 school year, over 54,000 alerts were received and 659 alerts were followed up on by building staff. Depending on the situation, follow-up actions may have included contacting parents, following the suicide protocol, utilizing school or district resources such as student support personnel, threat assessment procedures, IST, or others, utilizing community resources such as ComCare, DCF, law enforcement, drug and alcohol assessment information, and family crisis hotlines. These are a few examples of actual online search statements that were followed up on by building staff. The majority of alerts that were flagged referenced depression, suicidal thoughts, or self-harm statements. Here are several examples of feedback from parents in our district. As you can see, we do make a difference.
We're going to take some time and complete another scenario. Please pause the video and read scenario number 2 and discuss the questions on the handout as a group. This situation is concerning. In this situation, you should contact your building administrator or direct supervisor and let them know about the concerns. Your supervisor will contact safety services if needed and discuss next steps.
Wichita Public Schools has a process to follow when students express suicidal ideation. If a student makes a statement or action regarding hurting themselves, the staff member who heard this comment must notify a trained, certified related services support staff member like a school counselor, nurse, psychologist, or social worker. Some schools have behavioral health school liaisons that are trained as well. The student should never be left alone. We cannot promise confidentiality, as any time the student reports the potential of being a danger to self or others, it must be reported. Once a support staff member is notified, they may complete the following steps. Administering the Columbia Suicide Severity Rating Scale. The CSSRS is a simple series of questions that evaluate the current risk of suicide. Notifying parents and sharing information regarding warning signs, community resources, suicide-proofing their home, and tips for taking care of the student's mental health. Support staff may implement a safety plan when warranted. School staff should be prepared to collaborate with the family and community mental health providers after a suicide protocol has been completed. Some students may receive support through community mental health resources, and some may experience hospitalization for treatment. Regardless of the treatment option, it is important to provide support to the student, don't treat the student differently, and keep checking in on them.
Let's talk about mental health. We know we all benefit from a broader discussion of mental health, such as depression and anxiety. By having these discussions, we are able to break the stigma around mental health. Open conversations help to address issues that impact a student's ability to learn and perform on any given day, like attending school, academic achievement, and engagement. Fear, worry, and anxiety are all normal feelings. Fear is a response to something specific that is often perceived as an imminent threat. Fear can be life-saving. For example, if you were walking in the mountains and came across a bear, that fear would help you make a quick decision on how to keep yourself safe. Worry is a lesser version of fear.
More intense than worry is anxiety. Anxiety can cause a sense of unpleasantness and discomfort. A little bit of fear, worry, or anxiety can be a good thing. Anxiety can help you be alert while driving in a storm. It can help you meet deadlines. It can help you focus on preparing for an upcoming presentation. Anxiety becomes a disorder when it interferes with or impairs your ability to function at home, school, or with friends.
Symptoms of anxiety in children and youth include complaining of physical discomfort, stomach or headaches, avoiding people or activities, irritability, restlessness, increased or decreased appetite, inability to focus or concentrate, fear of normal, everyday things, having low self-esteem, being easily embarrassed, or being nervous or afraid to go to school. Sadness and depression are normal feelings. Sadness can be triggered by changes, disappointments, life events, or loss. Sadness generally is not long-term and does not impact a person's functioning overall.
Depression is characterized by a loss of interest in usual activities, increased agitation, irritability, moodiness, or lethargic behavior. Depression becomes a disorder when it interferes with or impairs your ability to function at home, school, or with friends. When depression starts impacting your daily life at whatever age you are, that is when there is a concern.
Depression can have an impact on the daily lives of children and youth in various ways. For example, a student may exhibit decreased grades in school, tardiness, or absences. Risk-taking behaviors like running out in traffic, erratic driving, unhealthy relationships, refusal to do usual activities, inability to focus, feeling helpless, having low self-esteem, reporting feeling sick frequently, eating more or eating less than normal, change in sleep patterns, disruption in relationships, or anger outbursts. Treatment works. Statistics show that 7 out of 10 teens with depression and 8 out of 10 teens with anxiety get better with treatment.
Take a few moments to look at this picture. Look carefully at the details. Now look at this picture and see if you can spot the changes. You probably noticed that Lee took Stephanie's place in the picture. Holly's bag is no longer there, and we all have our hands in the middle of the table. But did you also notice Stephanie's cup changed to Lee's cup? I took off my scarf, put on my badge, and put my phone away. Holly closed her book and no longer has sunglasses on her head. A very subtle difference that you may have missed is that the vase on the shelf behind us is no longer there. The purpose of this activity is to understand that as we interact with students and staff every day, it is important to take note of changes. Sometimes the changes are obvious, sometimes the changes are subtle or not visible at all. We are not going to always have clear clues about how someone is feeling. All we can do is do our best to be aware and pay attention.
It is important to pay attention and know the signs of suicidal ideation through a person's communication and behavior. Many students and adults casually use statements that can be concerning, like, "Kill me now," or "I could just die." We need to pay attention to the context in which these statements are said. Statements we need to pay attention to include saying that they're thinking of killing themselves or talking about death or dying, talking about feeling hopeless, guilty, or being a burden to others, stating that they have no reason to live, making statements that they feel trapped or have unbearable pain, saying that no one cares about them. Behaviors we need to pay attention to include increased use of alcohol or drugs, online searches about death or dying, withdrawing and isolating from family and friends, sleeping too much or too little, visiting or calling people to say goodbye and or giving away prized possessions, creating artwork, drawings, or writing about death or loss. While these are the things that we need to pay attention to, there are times when the warning signs are not obvious. Sometimes people can be really good at masking their pain. Other factors to consider are a person's overall health, mental health conditions, terminal illness, new health-related diagnosis, and drug use can all be risk factors. Other things to consider are environmental factors such as access to firearms, prolonged stress, traumatic events in one's life, or experiencing secondhand trauma. Additionally, previous attempts within a person's family or immediate circle and any history of abuse or trauma are also risk factors. Knowing all the risk factors is important. However, there are several ways to protect your mental health every day. Practicing positive self-talk. For instance, "I can handle this." Keeping a regular routine. Remembering your personal goals. Writing them down can help you focus. Spending time with family and friends. Spending time in the fresh air, sunlight, and getting up and moving can all boost your mood. Sometimes things can be overwhelming. We need to remember that people can and do recover from even the most stressful events or the most frightening thoughts.
Restricting access to means is another important safety measure. Typically, when individuals are kept from using a specific method, they do not attempt to find another way. It is important to note that the risk of death is even higher when firearms are stored unsafely. Individuals are 5 times as likely to die by suicide when there is a firearm in the home. Make sure to keep your firearms locked up and secured. Store ammunition separately, and if possible, store firearms away from the home, especially when someone is currently experiencing thoughts of suicide. Lock them up, lock them up, lock them up. I say it every year. Store firearms correctly. Remember, no one has to do everything, but everyone needs to do something.
And now, we are going to talk about what to do if you notice behaviors or hear statements that are concerning to you. 3 important things to remember in these situations are stay, listen, and get help. Do not ignore the statement or the behavior. Any unusual change in behavior could be a warning sign, and always take suicidal statements seriously.
Stay with the person. Provide non-confrontational support. Stay calm and positive. Listen and do not force engagement. Be non-judgmental. Use as few words as possible. Be proactive, not reactive. Just feeling connected to someone else can help. If they call you, talk to them. Being there for someone with thoughts of suicide can be life-saving. Increasing someone's connectedness to others and limiting their isolation has shown to be a protective factor against suicide. Providing immediate support during the often short-lived crisis can be what makes a difference for the person. Do not leave them alone. Talk to them about what's going on. Do not hesitate to ask questions. Ask the person, "Are you okay?" Let them know you notice something seems different. Let them know you care. Be careful not to ask questions as though you are looking for certain answers, and never promise to keep it a secret.
Listen to the person, let them guide the conversation. Try to understand their current perception of their world. Be non-judgmental and offer hope. Do not act shocked, angry, or disappointed. And do not promise to keep their thoughts of suicide a secret. Honesty and transparency in these conversations are important. Communicate in a straightforward manner. Communicate in a way that is appropriate for the person's age. And do what you can to help the person feel safe and comfortable. Pay attention to the person's body language and how they are reacting during the discussion.
You may wonder, what should I say? These statements are ordered from 1 star to 5 stars on ways to talk with someone who is thinking of killing themselves. You seem depressed, or are you okay? Are both 1-star examples. These are both close-ended and do not give the person the opportunity to elaborate. A better question would be, I have noticed some changes in you lately, and you haven't seemed like yourself. Do you want to talk? This question lends itself to more conversation and shows that you have noticed a change. A more compassionate way to start the conversation might sound like this. I care about you, and I have noticed some changes in you lately. You haven't seemed like yourself. I want to help. Do you feel comfortable telling me what's going on? This shows that you have noticed a change and that you care and are willing to listen. The final step is getting help. Connect them with someone who can help. Call 988 for the Suicide and Crisis Lifeline, or utilize the crisis text line. As a reminder, if the person is in imminent danger, call 911. Individuals who have accessed these resources were significantly more likely to feel less depressed, less suicidal, less overwhelmed, and more hopeful by the end of the call.
We're going to take some time to discuss a scenario. Please pause the video and read scenario number 3 and discuss the questions on the handout as a group. After discussing possible responses to this scenario, it is likely that you recognize that the first thing the parent needs is validation for their concerns about their child, and to hear that we want to support both the student and the parent. Additionally, we want to connect them to building support staff who can help them find community resources.
To meet the current needs of students and staff, Wichita Public Schools continues to support a variety of resources, including restorative practices, Second Step, ComPsych, our employee assistance program, mental health first aid trainings, the SABRE screener, the Mental Health Matters website, the Zero Reasons Why campaign, and a variety of support staff trainings. The SABRES is a social, academic, and emotional behavior risk screener that is utilized by Wichita Public Schools to assess the current well-being of the students within the district. Teachers complete the SABRES for students in grades kindergarten through 12th twice per year. Students in grades 3rd through 12th complete the My SABRES student screener one time in the fall. During the fall of the 23-24 school year, approximately 25% of students who took the SABRE screener rated themselves at risk based upon the overall score, which includes all three categories: social, academic, and emotional. Having this information allows for early identification and the ability to provide preventative supports. The Mental Health Matters website was introduced to the community in December of 2021. The website provides quick and easy access to resources for students, staff, and parents. Help us spread the word. We have added multiple family resources to the Mental Health Matters website. For example, the Crisis Nursery through Kansas Children's Service League and the Youth and Family Stabilization Program through the Mental Health Association are great resources for our 259 parents. The Zero Reasons Why campaign was adopted by Sedgwick County in 2021. It promotes community collaboration around suicide prevention and promoting wellness. Zero Reasons Why brings together student leaders and a variety of community members, including health professionals, to work together around mental health crises and to foster recovery. Youth Suicide Awareness and Prevention is a suicide prevention program presented to middle and high school students. The presentation takes one class period. Buildings determine what grades will participate. To schedule a presentation for your school, contact me, Holly Yeager.
A Friend Asks is a free app that provides tools and resources to individuals who may be struggling with thoughts of suicide. Having access to these resources could help save a life. Download the free app today. Speak Up is a resource for students to share information about safety concerns happening at school. It is also an avenue for the community to share concerns anonymously. Speak Up can be used by students to help keep a friend safe. Concerns can be submitted through the app, online, or by phone. And remember, Speak Up is completely anonymous. If you see something, say something. It is important for adults to be able to recognize the signs and symptoms of mental health concerns. We need to be able to listen non-judgmentally and reassure the individual experiencing a crisis. Youth Mental Health First Aid teaches adults how to help others find appropriate professional support and services. This is an early intervention public education program that is available to district staff members.
Our District Employee Assistance Program is ComPsych. The service is free to all employees and their household members, and it is strictly confidential. ComPsych is a 24-hour, 7-day-per-week support with up to 10 free sessions per event or topic. This is not connected to the district's medical health insurance plan, so even those not on the district's insurance plan can utilize this resource. The following are the top 3 categories of support sought by USD 259 employees through ComPsych during the first quarter of 2024. These 3 areas have been consistent over the past couple of years. This quarter, we have seen an increase in those seeking support for anxiety, depression, and relationships. We want to make sure that you are aware of this resource for all employees. If you have a coworker you are concerned about, stay with them, listen, and get help. Notify your supervisor if you are concerned. You can get to the ComPsych resource through the Mental Health Matters website. Make sure and note the web app ID, as you will need it when you sign in to ComPsych. The ComPsych website is www.guidanceresources.com. First-time users will need to register on the ComPsych website. There are a variety of additional tools and resources our staff can utilize on the ComPsych website. You can find information on a variety of wellness topics such as addiction, emotional well-being, fitness, and nutrition. Please take some time and check out these great resources that are available to you through our Employee Assistance Program.
Another great resource is the Crisis Text Line. The Crisis Text Line is available 24 hours a day, 7 days a week. In July of 2022, the U.S. Department of Health and Human Services launched the 988 Suicide and Crisis Lifeline. While the National Suicide Prevention Lifeline is still available, 988 is easier to remember and it will direct you to the Crisis Lifeline. Just like we would call 911 for a medical emergency, 988 is available for support during a suicide or mental health crisis.
This quote is a good reminder that even the smallest act of kindness can help someone more than we will ever know. Take a moment to read along silently as I read this quote from the Random Act of Kindness Foundation. Too often we underestimate the power of a touch, a smile, a kind word, a listening ear, an honest compliment, or the smallest act of caring, all of which have the potential to turn a life around. People are most driven to suicide when they view their current situation as being completely hopeless and feel as if they have no way to change things for the better. Suicide is a permanent solution to a temporary problem.
This is important. You will not cause someone to attempt suicide just by talking about it. You can help someone who is thinking about suicide by asking them about it and getting help.
It's important to look out for each other. Remember, this topic is applicable to all of us. Always be sensitive and supportive of each other. Be mindful, and if you notice warning signs, reach out.
Do not keep suicidal thoughts to yourself. Find someone you trust and let them know how bad things are. This can be your first step on the road to healing. Help is available, whether through a friend, teacher, coach, neighbor, therapist, or clergy member.
Dealing with a suicide crisis can be extremely upsetting. Helping others may trigger different feelings within ourselves. Talking to someone afterwards, like a friend, parent, or clergy, can help reduce our own stress. Remember to always take threats about suicide seriously. If you suspect someone is thinking about suicide, ask them about it directly. You will not cause someone to kill themselves by asking them about suicide. This is an important topic that continues to be a nationwide, statewide, and district-wide concern. We appreciate your time and attention.